Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello and welcome to Back into Alignment. My name is Joa Rivas. I am a yoga and Pilates teacher. For the last 12 years, I have been coaching in wellness over 1,000 people all over the world, and over 30,000 students have been passing through the classroom to practice the Posture School program. I wanted to welcome you to my podcast that I opened in 2018, a podcast that is created for those people that are having and experiencing back pain, neck pain, sciatica, rheumatoid arthritis, all type of back pain issues and inflammation problems in the body. This started because when I was 15 years old, I was diagnosed with scoliosis, and it took me 10 years to get rid of my chronic back pain. But here at 37, I am getting better and better, and that's what matters. In this moment, I do have osteoarthritis. I have 4 herniated discs and 1 slip disc. So I can tell you, I know how pain feels. Pain is a teacher, and this is the reason that I opened this beautiful podcast that I get to learn so much, asking questions to great experts and doctors. Today, we are excited to bring into our channel Dr. Khan. He is an expert of pain medicine and regenerative medicine in the city of Toronto. He specializes in interventional orthopedics using orthobiologics with X-ray and ultrasound guidance to treat patients. He was the first doctor in Canada to perform the published intraosseous infiltration of PRP. PRP, plasma, you probably have heard this before. Plasma is used to regenerate our body, our tissues, our cells, to reduce wrinkles, to make us feel younger, and even to reduce back pain. He is internationally renowned, treating patients around the world. Dr. Khan is currently doing a Health Canada approved clinical trial using stem cells for treating osteoarthritis. He is the CEO of REGENERATUS, a company dedicated to accelerating healthcare transition to regenerative medicine. Dr. Khan also teaches medical students and residents, and he's assistant clinical professor at McMaster University on the University of Toronto. Wow, this is an exciting podcast, and I can't wait to talk to Dr. Khan. Let's get comfortable, get some water or tea, and let's get to talk to Dr. Khan. Remember to share this podcast with your friends and family or anyone that can get benefits from listening about gut health and back pain. Hello, how are you today? I wanted to welcome you to Back into Alignment podcast today, Friday. Every Friday, we actually deliver new information about back pain. Back into Alignment was an idea that it came to me as a way to educate my people, my friends, my communities. And basically what we do here is we invite doctors where we have conversations about pains that are actually affecting us now and solutions that are easy to apply, and perhaps you never thought about it. Today, I'm excited because today we have Dr. Khan. He's actually here in Toronto, and I heard about him through many physiotherapists, and many doctors told me about him. As you remember, my first focus on this is actually to find my solutions. I have osteoarthritis, I have scoliosis since I was 15, and I continue learning so much, and I actually went to see Dr. Khan. He is a very grounded doctor. He actually can see you as approachable as any other doctor, even though that he has a great prestige in the city. And he's actually really knowledgeable, and he's bringing the latest technologies about medicine, which is so important for us. I used to be a bodybuilder, and I know that for people that are training so hard, we wear and tear the joints, and sometimes we ignore the pain until the pain shows and manifests in our body. So that's how I met Dr. Khan. I got to shake the hand, and he got to actually see my body, and I'm excited to in the future work together in one of his treatments, plasma. But before I continue talking, let's invite Dr. Khan to share a little bit about his experience in the medicine of sport medicine and about how does he see the next 2023 year coming and what type of technologies are coming into the medicine here in Canada. How are you, Dr. Ken?
Yeah, no, thanks for having me. I am a little bit biased, but I think the way medicine is headed is towards functional medicine and regenerative medicine. So what that means is getting to the root cause of the pain or the root cause of the problem, and then using cell therapy and gene editing and even tissue engineering, which can all kind of intersect into one to kind of form the next generation of cell treatments. So essentially, what I see happening in the next few years, you're going to really see a transition. And I think a lot of people are already starting to see it because, Joe Rogan and a lot of these big names, Tony Robbins just came out with a new book too about stem cells and all that stuff. And so a lot of the big mainstream celebrities are talking so much about it and the success they've had. So a lot of people want it, and it's patient driven. It's hard for the research to even keep up with like the demand. So I am doing some clinical trials as well in Health Canada approved trials in Canada. But I'm also doing research in the States and working in Dubai, working in Mexico with stem cells. So I'm working all over the world doing stem cells because I want to get more experience with it. And I really think that's the way it's going. So just to give people a little background, because I'm sure a lot of people are like, what the heck is a stem cell? So a stem cell, most people probably intuitively understand it can come from babies, embryonic stem cells or umbilical cord stem cells. And basically what they are, they're little molecules that have the ability to turn into different types of tissue. And essentially, a true stem cell can turn into almost any type of tissue, meaning it could turn into muscle, it could turn into bone, it could turn into cartilage, it could regrow different types of tissue. And so the holy grail of regenerative medicine is really to try to restore tissue to its previous state or repair or even regrow new tissue. And I think eventually we will get to a place where we can print organs and grow people new limbs even and new organs. And it sounds like science fiction, but a lot of this is actually going on with what's called biofabrication and 3D bioprinters. But the point is, I think people are starting to see that our medical system isn't working. And people who aren't from Ontario may not know, but our system actually did collapse. Essentially, we had overwhelmed emergency rooms. We had to transfer patients even out of country. So the system we have is reactive and it's not designed to sustain chronic disease. And with the aging population, that's the way we're headed. So the only way to really circumvent that is, I think, is functional regenerative medicine, because that's what gets to the root cause and tries to figure out cellular pathways that go wrong and intervene early before it's too late. And then by the time you're at a doctor, most of the time people go when they have a problem, not when they're healthy,
Exactly. Yeah, you definitely sent us so much. That was a bomb of information, but definitely the generation of the bone is affecting so many people, like you were just commenting. Many people wait until the end, until it's severe and acute, to be able to find a solution. And we actually encourage you to prevent it by having a proper nutrition. Today, we actually will be chatting about gut health. There is actually something that has been ignored, that is the ultimate connector between the brain and the body, the spinal cord. The spinal cord is the ultimate connector between the brain and the body. And this is something that people ignore. And we can actually start feeling the symptoms when we do have scoliosis and we are hunched over. We're not opening the space of our body to have the organs in the proper position. But beyond that, our brain, the second brain is our gut. So can you please tell us a little bit about something that has been ignored by chiropractors, physiotherapists, orthopedics, the gut health, like gut health, really, yes, gut health. Tell us a little bit about the second brain and how important is the gut health for the spine.
Yeah, so the reason why it's called the second brain is because it's its own nervous system. So meaning it has so many neurons, and essentially the way it communicates through your whole body. So for example, there's something called the gut-brain axis, which you talked about, how the gut can affect your mental health and everything. But there's also something called the gut disc axis. So gut disc means that the gut communicates with your disc in the spine. And there was a study that was published earlier this year that showed how that happens. And what happens essentially is there's what's called intestinal permeability, or people know it as kind of leaky gut syndrome, which is basically where you get little perforations in the intestinal lining. And so there's particles that can go into the bloodstream, and that can actually go into the and it's called translocation. And basically those bacteria can translocate into the disc as well, or into your knee or into your hip. So basically meaning that the gut can affect joints and disc and cause inflammation and cause pain. So that's why actually one of the treatments for degenerative disc disease, and it's been shown to be somewhat effective, but it's not great, but it does work decently, but it's actually antibiotics. So why does antibiotics help back pain? Right, and it's a weird thing, but it does work. If you Google antibiotics back pain, there's lots of research on it. But the reason is because there's bacteria that go from the gut and go into the disc. But unfortunately, antibiotics have so many other side effects, and so we don't really want something that's just like antibiotics are basically like a rocket or like a like a nuke. They're gonna take out all the bacteria, like the good and the bad. So what we really want is we want treatments that are immunomodulatory, meaning that they can modulate your immune system to send the right signals to help decrease inflammation and help to decrease the bacteria, and then help to promote an anti-inflammatory and regenerative environment. So those immunomodulatory signals, the best treatments that we have to date are probably a combination of peptides and then also cells therapy like stem cells, different types of stem cells. And so that's really what we're trying to do with those treatments is we're trying to send signals to change the environment from catabolic, or meaning like breaking down and inflammation, to more anabolic and anti-inflammatory. So that's essentially the idea. So the gut is so important because it's really where a lot of chronic health issues start. There's even studies about the Parkinson's disease and the gut health. So people don't realize gut is actually where a lot of problems start, including autoimmune conditions, but even chronic inflammation and pain.
Exactly. Yes. Well, you went through all this information. I'm sure people have to like go slower. Thank God we have the option of 2x and 1x, and then, okay, you may have to put it 0.5.
I know I have so much information. I know, but
Yeah,
we can dive deeper as we go.
Now, let's say the peptides that you are commenting. Can we just go deeper into just the peptides? Like,
Well, yeah, the peptides. So, for example, there's one called BPC 157, and that one's been shown to help promote gut healing, and it actually helps with regeneration as well. So, it can help people who have chronic gut issues, and it's essentially, like I was saying earlier, immunomodulatory, which means it helps to modulate or helps to kind of fine tune your immune system to send the right signals. And then you can use a BPC peptide in conjunction with what's called thymosin alpha 1 and thymosin beta 4, or short form TA1 and TB4. And essentially, those are also immunomodulatory. And so the three of them together can work really well to restore immune dysfunction. And people who have a lot of chronic inflammation, it starts with immune dysfunction, and that starts in the gut, right? Because a majority of your immune system is in the gut. I'm sure most people know that now, because that's been sent out there for years now. But it's becoming more, I think, the treatments are becoming more specific and precise because we're trying to get to the root cause, as opposed to just saying like, take this antibiotic. Yeah, it might help, but it'll also destroy your good bacteria. So can we be more specific and more precise? And that's kind of what we're trying to do with the peptides and the cell therapy.
so the peptides are actually injected in the body. Like, how is the method?
Yeah, so peptides, I should maybe rewind a bit, but basically they're a chain of amino acids. So it's like a baby protein. So that baby protein, think of it like a signal that's sent towards, and they have different signals that they can send. And so that signal can be sent to your gut to help improve the lining of the gut, reduce inflammation, and help promote regeneration. And basically, the idea behind the peptides is that they're going to help promote an environment that's going to allow your body to heal. So the peptides aren't like drugs in the sense that they're blocking a specific receptor. What they're doing is they're just sending signals to help promote the right type of environment that you're trying to achieve. So that's a big difference.
And this is injected in the body in specific areas, or how is the procedure?
You can inject it subcutaneously. So generally speaking, it's just injected just like insulin, or insulin is actually the most common, well-known peptide. Everyone knows insulin, right? Insulin was the first peptide that was discovered and injected. So obviously, everyone in the world knows what insulin is. So that's the most common peptide prescribed in the world. But there's so many other peptides now. There's weight loss peptides. There's peptides for growth hormone releasing hormone. So peptides are a really exciting field, and that we just got approval to prescribe them in Canada. So I'm really excited. So because for chronic inflammation and pain, it can be a really good adjunct.
So, why there was a restriction using the peptide on a?
Yeah, I mean, well, Health Canada and Canada's just behind with everything, so it took a while, but we got approval to be able to use peptides now, so which is nice. But I think, unfortunately, with a lot of these treatments, because there's not big pharmaceutical companies to do billions, they're not billions of dollars behind it, so you don't necessarily have that same level of evidence. But you also don't have that same amount of manpower to kind of get those approvals and all that stuff. So there's a lot of lower level evidence, I would say. But at the same time, these treatments also have a much less potential for harm. They're not as strong as like, you know, an immunosuppressant that suppresses your whole immune system and can have a lot of side effects. So you have to always look at, whenever you're looking at these treatments, you have to also look at the fact that they're natural in a sense, or like minimally they're pretty benign, like they're unlikely to cause any harm, and they can have a lot of potential benefit.
And as an expert in pain medicine, how effective do you find the peptides in the athletes? Let's say athletes that have injuries. Have you
Great.
seen?
Like honestly, I've seen people with acute injuries and like they take BPC and one called TB500, which are both regenerative peptides. And like if they get an acute muscle tear or strain or something, they take it right away. Like within 2-3 weeks, they're like back to normal. So it works amazingly well for acute injuries. And for chronic, it's a bit more complicated because you have to kind of use those other peptides I was talking about for immune dysfunction. But they can work really well too for like chronic Lyme disease, chronic fatigue, and that type of stuff. And so you can really hone in on that immune system response. And I find this really, it works very well with the plasma and the stem cells as well, because again, it promotes regeneration.
Talking about autoimmune issues, have you applied any of these techniques on rheumatoid arthritis, for example?
Yeah, we're actually using intravenous stem cells, which are, it's not allowed in Canada, unfortunately, but I'm doing it in Mexico, Dubai, Italy, Spain. I'm working all over the world doing it now. And basically what we do is we take stem cells that are donated from healthy young donors, they're strictly tested, and you expand them in the lab. So expansion means you grow them and you expand them to like 200 million cells. So, and then you put them intravenously. And then when they go IV, they go throughout your whole body, and they do that immunomodulation that I was talking about earlier. And they actually help to decrease inflammation and shift rheumatoid arthritis from a pro-inflammatory state to an anti-inflammatory state. So basically, it helps to make everything better in the whole body systemically. So it's pretty cool. So there's been case reports where people were actually put in remission with one IV stem cell treatment. So it's pretty amazing. So I'm treating people with rheumatoid arthritis as well using those stem cells.
Stem cells, but that particular practice is not available in Canada.
Not yet. I'm working on it with University of Toronto, but hopefully we'll have it here in a few years. But you know, it takes time.
It's like case studies.
There's case reports published like around the world, but in Canada, we're not allowed to expand stem cells. Like I'm doing a clinical trial where I can take stem cells like from your body, and then we can just inject them back in, but we're not allowed to grow them. So the growing of them is what we're trying to work on to get approval to do for our next study.
Okay, well, good luck with that. I hope,
yeah.
Canada can also be part of that.
I know, catch up rest of the world, right?
Exactly. What about osteoarthritis and gut health? You actually posted on your Instagram channel 3 ways to combat the osteoarthritis with paying attention on gut health. What are the 3 tips that you actually share with us?
Well, I think so the biggest thing I think for most people is reducing refined carbohydrates or processed sugars, because that can affect your gut health quite a bit. And then the other one is increasing your fiber intake, because that can feed your good bacteria. And then the other big one I think a lot of people probably don't do is eating fermented vegetables on a daily basis. Because a lot of people take a probiotic, but probiotic, that's a whole topic on itself. You can do a whole podcast on what type of probiotic is the best, but basically there's a lot of variability, and there's different strains, and there's a lot of complications there. And also you might need something more specific for your body. So I feel fermented vegetables are a good way to get like a good general profile of good bacteria for your body.
Yes, so, and to choose those that are actually as simple as salt and the vegetable. Let's say
that's it. Exactly, yeah.
Cabbage and salt. You don't need sugar adding. You don't need to add any vinegar. That's supposed to be the process of fermentation. Also the artificial sweeteners. Splenda, for example. Can you please tell us the misconception about Splenda?
Well, I think a lot of people don't realize that artificial sweeteners can affect gut health too. There's a study in Israel that came out a few years ago, and it was in mice, but it still showed that it did disturb the gut bacteria, like the good gut bacteria. So a lot of people, you know, especially with pre-workout drinks and a lot of other drinks out there, they use artificial sweeteners quite a bit. So I think you need to be mindful of that if you're trying to optimize your gut health. But in terms of like, I guess natural, like there's so many natural alternatives now, I think. Like, so people like just like there's, you know, there's like monk fruit, there's xylitol, there's like other ones that now people use. And so I think you can find products that have those other natural sweeteners. Oh, I think you're on mute.
Okay, that's so funny. I live right in front of the lake, so sometimes I never know when I'm gonna get ambulance. So I'm always like crossing my fingers. It's quiet here. I was just commenting about natural sweeteners like stevia. That is actually a leaf that you can actually grow in your home, and you can literally take a piece of leaf and put it on your tea, and that will add that sweet flavor. If that's what you're actually looking for. What about honey? What's your thoughts about honey, raw honey?
Yeah, I mean, I personally am a fan of it because it can have benefits for your immune system as well as it is relative. It's yes, there's sugar in there, but sugar isn't the devil, as many people will claim. They will be like, you have to avoid all sugars, even natural sugar, but it's not that simple or black or white. And in terms of honey, as like for most people, I think it's a really good source of natural sweetener and minimal. There's no real downside to it.
Mm-hmm. Yes. Now, in terms of scoliosis, in from a musculoskeletal level of structure, since the scoliosis actually it creates a lot of compression in the spine, could this affect the digestion and how?
Yeah, well, that's the interesting thing. I think it comes back to breathing, to be honest, because breath is one of the foundations of health, I would say. And if you don't have good diaphragmatic breathing and you're not able to open up your airways and get that breathing in properly, which a lot of people with scoliosis can't, then it's going to ultimately affect it's going to affect how your body, it's going to affect your gut health because it's going to affect your whole nervous system. And so I would say that's at least how I think the mechanism would be in terms of why scoliosis can affect your body systemically. It's because of breathing. And
In
breath
your
is
decades of practice, have you seen this common symptom where someone that has scoliosis has also got issues?
Oh yeah, yeah, for sure. It goes. I see it very commonly, and people with scoliosis. The problem is, I think they also feel like they get labeled and like, I don't think scoliosis is necessarily something that can't be overcome with like the right type of therapy. I mean, you've gone through it yourself, right? Like, so like with the right type of therapy and the right practitioners, you can really most people can get better. So it's not like a sentence to mean, and a lot of people get scared, right? They're like, oh, I have scoliosis, I shouldn't work out, or I shouldn't go do this. It's like, no, you can actually work out and you can do it in a safe way. You just need someone who understands about mechanics and is an expert in scoliosis to help you.
Mm-hmm. Yeah, as you were commenting, because people that have some type of spinal dysfunction, they may be shortening the rib cage. They are compressing. They're not able to really feel the lungs or like bring the air down to the diaphragm. This causes mouth breathing, right? So
Exactly.
can you please tell us a little bit of that? You were commenting breathing. Breath work is the number one important systems in the body. Unfortunately, people are breathing through the mouth. You can see people snoring, having apnea, and all these issues. And also, even bacteria also will affect the gut health with the
Yeah, I
breath.
mean, there's a whole book about it, Patrick McEwen's book,
Yes,
The
yes.
Oxygen Advantage, I believe. And honestly, if you like, that's how depth the topic can be. But basically, breathing can affect everything in your body. And so if you don't, and it's one of the foundation pillars. So if you don't know how to, and they don't teach you how to breathe in school, which is so funny. Like I feel like it should be a fundamental part of like curriculum.
Yes,
So I think it's
I'm working
something
on
that,
it.
yeah,
I'm
exactly.
working.
Good. No, and that's why, yeah, we're trying to bring into corporations and try to teach people because it's such a foundation of health.
Mm-hmm. Yes, it is an essential part of life, but it's ignored. It's so funny how the easiest things in life and the most simple ones are the ones that we forget to do. Because gut health is such a broad topic. We can literally talk from bacteria to microbiome to the depression, like so much that is created in the second brain. I feel like everybody wants to know the two takeaways from our conversation, something that you feel like people are simply either ignoring or people are simply not paying attention, and it's like the cause of many issues that you have seen with your patients. Can you please share something that perhaps it can bring a little shed some light in those people having pain in the body?
Yeah, no, I think I think a lot of people are very stressed these days, and stress can affect gut health as well. And people may not realize, they'll be like, oh, I'm eating well, I'm doing all this, but it's like, okay, well, how, like, but then they're thinking about work all the time, or they're thinking about something all the time, and they're never really relaxed. And there's something called a relaxation response, which is an actual physiological mechanism which helps to, it helps to decrease inflammation, and it helps to reduce cortisol. And that is something a lot of people don't do enough of, I don't think. That is meditation, or finding something that's meaningful, that actually makes them be present in the moment and helps them enjoy life, because everyone's just kind of running around and doing things. And so I feel like that's overlooked a lot. And the other thing would be, I'm a big proponent of muscle, because muscle is an actual organ, meaning it secretes messenger cells called myokines, which go throughout your whole body, and they help decrease inflammation, and that can help promote gut health as well. So I think most people know like the obvious stuff, like like probiotics, fermented vegetables, blah blah blah, but people don't often think about the other things that can affect it too.
Mm-hmm. Exactly. Number one that you are commenting, I relate to gratitude. Just feel gratitude of living life through a practice. You can find your practice from praying to any of the religions that you follow, or if you are like me, someone that just meditate to thank life, to live one more day, then we welcome you to start practicing something that gives you some relaxation to balance your cortisol and to bring the melatonin so you can sleep nice. And sleeping is one that is been forgetting, right? A lot.
Yeah,
Sleeping.
no, stress and sleep are intimately related. So
Exactly.
if you're stressed all the time, even if you're sleeping 7, 8 hours, but your mind is thinking of things, you're not going to have quality sleep. And so that's where people don't realize. And that's why the problem with most prescription drugs too is they don't actually make you have quality sleep. They may increase the quantity of it, but it doesn't actually increase the quality of it, which is like the deep sleep, the REM cycles.
Exactly. And the sleep is actually related to the breathing, right? You are actually breathing through
Exactly.
your mouth.
It's all
It's
related.
like so funny. All these topics are all interrelated. We are a holistic being. We are connected through so many fields of energy in so many ways that it's
Yeah,
very hard to say that it's only one piece. At the end, it's
exactly.
an integral way to see. Very excited to see you today. We're also chatting about the muscle, very important for the woman listening to this podcast. We remind you that after 35, we are heading towards sarcopenia, meaning that you are losing your muscle every year. And every decade that you lose your muscle, you actually decreasing the potential to live. Longevity starts with muscle, and it doesn't mean to be a bodybuilder. It simply means to activate and to stimulate the muscle. The last question, I think your motto that you were sharing here is live your best life. Tell us, Dr. Khan, how do you live your best life when you're traveling and you have to take all these flights and you're jet lagging? How do you live your best life in this?
I think the foundation is being at peace, like meaning you have to find what brings you peace at your heart and like in your soul, whatever universal, whatever, doesn't matter if you believe in religion or not, but I think there's, we all have some sort of, there's, I think, idea that there's some sort of universal energy, like you said. And so you have to find what brings you peace. And for a lot of people, unfortunately, they don't like their jobs and stuff like that, but I find my work very meaningful. And so it does bring me a lot of happiness and peace. So even though I'm working all the time, like I don't feel like it, because I really genuinely enjoy what I do. And I love being able to help people and make a difference in their life. So that brings me peace and happiness. But everyone is going to be a little bit different. But I think you have to find what is that thing that makes you actually feel genuinely at ease and in your heart.
Exactly. Yeah, we are delighted to have you today and to have you on the next 3 podcasts. We welcome you to ask questions to Dr. Khan. We're going to be having him for 3 more weeks. So please make some comments if you find that this topic was something that ring the bell to you, maybe some type of information that you never heard before. Even if you want to know more about stem cell therapy, you can always call Dr. Khan. Can you please remind us about your clinic and where can we find you?
Yeah, Instagram's the best place, at dr.acon. I'm pretty accessible. My email's on there, and my assistants can help connect anyone who needs help. In terms of where I'm located, I'm kind of all over the world now. So I'm in Toronto for a bit, but then I'm going to be in Mexico, then I'll be in Dubai, I'll be working in Italy, and then I'll be in Florida. So I'm kind of all over.
Super. That's super. I am happy that you're able to do what you love all over the world. So you are actually causing a big impact in the world, bringing medicines that have been perhaps traditional for too long, and you're actually putting new ways and new technologies that we all need. technology continues, and medicine have to continue with technology. And we are really hoping these case studies that you are putting are going to be getting into the stem therapy growth. And so sometime soon, people will be able to receive the same therapies that other countries are already allowing. So thank you so much, Dr. Khan. I can't wait to have you the next week. And thank you so much, my friends. I hope you enjoy this chat. Remember that together we are stronger. I hope you enjoyed this podcast as much as I did. I hope you took notes because we learned so much about gut health and back pain. If you want to find Dr. Ken, we can go into Instagram or TikTok to dr.akhan, or you can just travel to Dubai where he's going to be on the seminar with Ben Greenfield. Yes, Ben Greenfield, a health and wellness influencer. If you have some questions about this topic from today, gut health, please send the questions right into his Instagram or to this channel. Remember to subscribe to the channel in Apple or Spotify. We also have the YouTube and the record video with Dr. Ken. I hope you enjoy this podcast, and I can't wait to have you next week. Thank you.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.